came up. Similar to how Chiari, the idea is maybe you can outgrow it. Is the same true of tethered cord or tethered cord syndrome? Because on one of our recent things, we discussed how those things are different. But have you seen that?
Tethered cord syndrome is essentially having the symptoms of tethered cord, and tethered cord can be an imaging diagnosis, a little bit like Chiari. That's a whole other topic, obviously. It is sometimes very straightforward to diagnose tethered cord because you can see the bottom part of the spine is really, really low, and it's a no-brainer diagnosis on MRI. It can sometimes be more difficult if the spinal cord is not very low, maybe it's just subtly low, and for complicated statistical reasons that in that individual that might be actually worse than what you think it is, because not all of our cords are programmed to be at the same height. And if you were one of those people that was programmed to have a really high cord and now it's normal, like perhaps it's actually getting stretched. So having said all of that, there are at least subtle features of tethered cord and lots of normal individuals that are perfectly happy and healthy and walking around and just happen to get an MRI scan for some unrelated reason. So that's common. Tethered cord syndrome, on the other hand, is relatively rare. The most common symptoms of that are back pain, leg numbness, bowel and bladder changes, or leg weakness, or some combination thereof. The most common symptom of that list is back pain. When I'm operating on somebody for tethered cord, I generally feel more confident if I'm operating on symptoms. I feel more confident if there's some combination of those. If they just have one of those symptoms, it's possible, it's certainly possible, but you wonder a little bit about the diagnosis unless the MRI is very, very clear. There are some physical examination features, which I'm not going to get into, which will help you make that decision as well. By the way, can somebody outgrow it? That answer is not scientifically proven one way or the other. My opinion is people probably do not outgrow tethered cord symptoms if they are tethered cord symptoms. It's a little bit like Chiari. One of the problems with diagnosing tethered cord syndrome is that the symptoms like back pain is incredibly common in the population with or without tethered cord. So then it's a little bit like having a headache and a Chiari. You gotta spend a lot of time trying to sort out, is this back pain coming from the tethered cord? If you have back pain and you may or may not have tethered cord on your MRI, and then your back pain just goes away and stays gone away forever, I don't think you probably, in my opinion, in that hypothetical scenario, you probably didn't outgrow your tethered cord symptoms. You probably just had back pain for another reason. Not everybody with tethered cord on their MRI has symptoms or even will ever get symptoms. We talked about the correlation between tonsil position and symptoms, like the lower your tonsils are, the more likely you are to have symptoms. The same is true for tethered cord. The lower your spine is, the more tethered it looks on MRI, the more likely it is that you are going to have tethered cord symptoms. We wrote up a series of those a few years ago, and at least in our estimation, if you have a spinal cord that was 3 segments too low, over half of those kids had symptoms. Whereas if you have a spinal cord that was within 1 segment of normal, then very, very few of those kids had symptoms. Mostly it was just an incidental pickup. So how low your spinal cord is does kind of predict that. We'll do a so-called prophylactic untethering operation with no symptoms when your spine is really, really low, just because we think it's very likely that you're going to have symptoms eventually. When your cord is a little bit higher, not that low, we won't do prophylactic operations. We'll just watch out for any symptoms if they arise.
Okay.
So yeah, I suppose, again, you asked a simple question, you're getting a complicated answer. I never say never, and I never say always. There's always exceptions to every rule. So could somebody outgrow their symptoms? Yeah, I guess, maybe, possibly, but I've never seen it. I think if you have real tethered cord symptoms, it's probably just going to keep getting worse. That would be the expected natural history there. But if you don't have any symptoms at all, you might never get them.
Right.